Cerebral palsy caused by a lack of oxygen. Want to know what I'm getting at here? Stay with me as I share with you this very important information. Hello, I'm Marcus Boston, and I'm a childbirth injury and medical malpractice attorney practicing law in the state of Maryland, and I would like to quickly talk with you today about a cause of cerebral palsy, or how, after a baby has suffered a brain injury during a vaginal delivery, how a subsequent cerebral palsy diagnosis can manifest itself. All right, so essentially, what is cerebral palsy? Well, what it is it is a movement disorder. It affects movement. That's generally how we see it. And for today's video, I want to talk about a cause or something that can lead to a cerebral palsy diagnosis during a vaginal delivery, and that is when a baby is not getting enough oxygen during the delivery. Now, doctors can sometimes tell that a baby is in what we call fetal distress during a vaginal delivery. And for the term for fetal distress, we're essentially talking about a baby that is no longer tolerating a vaginal delivery. Doctors use tools such as the electronic fetal heart monitor to help them determine how well the baby is doing during the delivery process. So the electronic fetal heart monitor is looking at things like the baby's heart rate. It's looking at variability. And when we're talking about the baby's heart rate, a normal baby's heart rate is going to be anywhere between 120 to 160 beats per minute. If the heart rate gets too high, above 160 for a considerable amount of time, now we're looking at tachycardia. If the baby's heart rate is too low, when I'm talking about too low, I mean 100 beats per minute or lower for a considerable amount of time, we then may be crossing into the area of bradycardia. So the electronic fetal heart monitor is looking at these things. It's looking at variability. It's looking at late decelerations. And doctors and nurses have to take the time to accurately read and interpret the fetal heart monitor. What can happen is if the baby is in distress and is no longer tolerating a vaginal delivery, then what we can have is an injury to the brain. A lack of oxygen can manifest itself in a lot of ways during a vaginal delivery. For example, you can have an umbilical cord compression. And the umbilical cord, just stepping away from some of the big medical language, but essentially the umbilical cord is the baby's lifeline. And if that umbilical cord can get compressed during a vaginal delivery, then you can have a lack of oxygen getting to the baby. The fetal heart monitor, what I talked about earlier, it will show certain things. It will show those late decelerations. It may show a sudden drop in the baby's heart rate. It may show minimal variability. So if all of these things are going on and doctors do not help the baby out, if they do not move to an emergency C-section when warranted, what can happen is the baby can then suffer a brain injury. And that brain injury can then be a subsequent cerebral palsy diagnosis. So why have I taken the time today to talk with you about this really important information? Because more than likely, if you are watching this video today, more than likely your baby has suffered a brain injury at birth, and you now have questions as to what do you do next. Maybe the doctors have given you a cerebral palsy diagnosis in regards to your child, and you remember that your baby had a lack of oxygen going on. Maybe the baby was blue in color. Maybe the baby had seizures. Maybe the baby had meconium present. Maybe there were low APGAR scores, and you know that the doctors did not move to an emergency C-section in your case. If you have all of this going on and you would like to speak with me further, this is what I invite you to do. Go ahead and pick up the phone and give me a call. I can be reached toll-free at 1-833-4BABY-HELP, or you can reach me locally at 301-850-4832. If you prefer to send me an email, you can send me an email to medicalinjury@bostonlawllc.com. I answer Maryland childbirth injury and medical malpractice questions just like yours all the time. and I will be happy to take some time and listen to your story. All right, that's going to be it for today's quick educational video. Again, I'm Marcus Boston, and I'm one of the childbirth, injury, and medical malpractice attorneys here at Boston Law Group, LLC, and we will see you next time. Take care and enjoy the rest of your day.